Okay, so good morning, everyone. My name is Tyann Trong. I am a therapist based out of Oklahoma City, and I am joining forces with my two dear friends and very skillful TEAM-CBT therapists, Dr. Amy Huberman and Eunice Melakile. And we're just really excited to share about written exposure therapy with you all today. We've started to learn it together, did some consultations about it, and then actually practiced it with our clients and feel excited to share about it with you. So I'll let each of them introduce themselves to you, and then I'll jump in with the presentation. Do you mind starting, Amy?
No problem. Yeah, so I'm Amy Huberman. I'm a psychiatrist in Baltimore, Maryland. But I actually don't prescribe medications anymore. I specialize in doing short-term intensive work, helping people overcome struggles with anxiety, as well as trauma. Yeah.
Glad you're here. So yeah, if you're in the Maryland area and need to refer out for intensive therapy, specializing with anxiety, OCD, and trauma, Amy is just a person I would trust with anybody. My loved ones, I would send them your way, Amy. So thank you so much for being here.
Thank you, Tyann.
Okay, and then we have Uni as well. Her name's Eunice, but we call her Uni.
Hi everyone, I am Uni. I worked with Tyann for a while. She was actually my supervisor when I was a practicum student, and it's a bond that is lasting and it hope to last for a very long time. I've been practicing on my own, just started my own private practice this year, just diving into trauma care and doing some and got introduced to WET therapy by Tyann, and the consultant that we worked with is Dr. Lack, and he was my college professor. So it was really nice to just have his teachings again. And I'm really excited to share this new model with you guys, how it helped my clients and how I enjoy it too. So I'm excited for today.
Yeah, I'm so grateful that you're here as well, Uni, and just excited that you've launched your practice this year as well. And that I have Uni's my main referrals that I send everyone her way whenever people need services. So just grateful that you're here. I know your passion for trauma treatment and really excited to hear about your case and for others to get to hear about it too, because I think the change has been pretty incredible for your client. Okay, and then we're going to jump right in. Looks like Dr. Lack has an endorsement here. Dr. Lack was my professor as well. I learned WET through him, and it's so amazing. Yeah, it's awesome. Okay, so we'll begin the presentation. I'm going to go ahead and unmute everyone, and if for some reason you're jumping in and you happen to notice your mic is unmuted, if you could stay muted for us as well, please, so that it can just really decrease the background noise and distractions. And then we're gonna jump into the presentation. Just arranging the settings for the recording here. Okay. So we are talking about written exposure therapy. Okay. Also known as WET therapy, but if you connect with Dr. Lack, he does not like it being called WET. So you can call it a WET, but it makes sense to me to just call it WET. Okay, let me just close out this other view here. Okay, so Amy and Eunice and I will be sharing about written exposure therapy, but we're also integrating it with TEAM-CBT. And we found that when we integrate some of these components, it helps for it to become even more effective in connecting for the client. And as you all know, TEAM is just a structure of therapy that then we can use any tools during the methods. And the structure seems to help improve connection. And as we work through resistance first, it seems to be more effective for people. And so TEAM is an acronym. T is the beginning of the process where we do some testing and measurements. WET does encourage assessing for PTSD, and all of us just use the PCL-5. And if you just click on this link, it'll take you to where you can access the one that has the time frame of in the past month. That currently is the only one that's been validated, so I encourage using that one. It's a 20-item self-report measure that really helps us to accurately assess for symptoms of PTSD, but they do encourage combining it with a clinical interview and doing a structured interview like CAPS-5 if you want to have a more accurate measure of PTSD. So to not use it as a standalone diagnostic tool, but it just helps to inform. And if they have a cutoff score of 31 to 33, then that suggests that they will likely benefit from some PTSD treatment like WET, and some other validated treatments as well, including prolonged exposure, CPT, which is cognitive processing therapy, and EMDR. And I've really liked learning more about written exposure therapy and seeing the benefits of it over some of the other longer-term therapies is that the one thing that really stands out to me is it just has a much lower dropout rate. It seems to be a lot more tolerable than prolonged exposure, which can be very overwhelming for the system to rehash the memory verbally. And they even encourage doing it in present time with prolonged exposure. And for written exposure therapy, you're writing about it as if it's a past memory. And I think that makes it less overwhelming for the system. And CPT and prolonged exposures are usually 12, 15-week sessions, a 12 to 15 session treatment process. And written exposure therapy for what we've done, it's set 4 or 5 sessions, and a couple of us have done 7 to 8, but that's still pretty incredible to see a major drop in PTSD symptoms in roughly 5 to 8 sessions for people. So I've grown to really like it and even prefer it compared to the other 2 treatments. And yeah, so that's the testing that we encourage there. And then talking about empathy, we know the WET protocol doesn't really emphasize the importance of empathy. It even talks about that even though the client isn't doing a lot of verbal processing with you, they don't rate empathy as any less than when they've worked with a therapist where they did verbal processing, like with prolonged exposure or cognitive processing therapy. And at the same time, Amy and Uni and I discussed that we can't help but imagine that empathy could actually harm the process. It could be anything but helpful in just building trust and connection first. So we use the 5 secrets of effective communication. And then I'll share with you some example empathy statements as well while we stick with the WET protocol on how we can still integrate the 5 secrets of effective communication to enhance connection, build safety, and to just really make some space for them. Okay, so ratings of empathy and satisfaction, again, is very similar with WET compared to the other verbal processing therapies. And these are just some example statements. So I'm trying to keep fidelity to the WET protocol while just giving you some example statements of how we can continue to use empathy to connect with them through that process. So I'll go a little bit more into the WET protocol later in the slides, but just building connection with them, we can use affirmations or stroking statements like, I just really admire you doing this hard work in order to heal. I know you express wanting to be more present for your family, and I do think that's really admirable. And so we can just make statements where I see your efforts, I see your hard work, and I admire that about you. And I think that just really helps them to feel seen and validated in how hard this work is as well. Okay. And then inquiries that you'll see in the protocol as well is just assessing uh, how did things go in between the sessions. And so we could just word it like, how has things been going since the last session for you? And while we're not deeply verbally processing the content, we just want to know, how has it been going? Has it been hard to follow the directions of continue to allow thoughts and feelings to come up, allow the memories to be present instead of avoiding them? And so we're just asking questions and sitting with curiosity with some of those inquiries. Feeling empathy and additional affirmations could be like, it sounds like it's been more painful to allow you to think of the trauma instead of pushing it away. But it sounds like you were able to allow yourself to go there as well. What was that like for you compared to the previous times of avoiding it or pushing it away? Right. Okay, and then just disarming and thought empathy. I think for the three of us, it's hard to just not weave in the 5 secrets as we're going through the protocol with them. And so as they're sharing anything about like, gosh, this has been hard, it's been so painful, we can just disarm them. That makes sense. Um, it also makes sense that sometimes there is a part of you that doesn't want to continue this. It feels so painful. It's excruciating for you to go back there sometimes. And so if they're using words like this is excruciating, I would then just use some thought empathy with that. It is excruciating. It is so painful to go back into that painful time or whatever that trauma was, to think of your child passing away or losing your friends, your buddies at the war, or to go back to that sexual assault. That is excruciating. And then the I feel statement is, I had shared this with my client. I did find myself tearing up reading through what you had to go through with losing your child, because that's what my client had worked through. And so sometimes I think it's beneficial. So in the WET protocol, we're having them write about their trauma, but we do read the trauma narrative. And I think it can be helpful to just share with them, as a human being, I was impacted by the content and the hardships that you had to go through. And it's just a brief statement for the benefit of the client to share our human emotions and that we care about them and that their hardships impacted us. And I think just that brief empathy alone, even though it's not emphasized in the WET protocol, can just really help to enhance connection. Okay, did Amy or Uni have anything to add to that before we go to addressing resistance? So that was T and E, testing and empathy in the team structure, and then A is addressing resistance.
I can just share that the patient that I worked with expressed what a difference it made when I did do some affirmation and stroking, and just acknowledged how I saw how hard he was working at the process, and how much courage it took to go through it, and just the commitment to um, growing and being able to connect with family at the end of the process.
Mm-hmm.
And yeah, that just, I think the empathy is still such an important piece that, you know, he said that that just sort of made all the difference. And hearing that from me and wanting to continue um, doing the hard
Yeah.
work. Yeah.
Yeah, I can't imagine that being anything other than helpful and connecting, Amy, and just hearing some of the statements that you're sharing where you're telling them, I see your hard work, and I see your courage that you're having to access to go through this. And even pointing out, like afterwards, you're connecting more with family or you're seeing their progress. That to me, if I put myself in your client's shoes, I just feel then so seen and validated. And I even actually feel an oomph to continue to keep going because you're acknowledging my courage and how hard it is too. So yeah, I really appreciate you sharing that. And as you all know, we use the brief mood survey and the evaluation of therapy session with TEAM-CBT. And I think the empathy shows when in the evaluation of therapy session, they continue to mark, I feel completely heard, understood, I feel your warmth, I feel cared about. While we don't have any clinical testing, I'm just curious, like if we were to measure through the ETS, if it was just WET alone without the 5 secrets versus WET alone with the 5 secrets, how that could possibly be different on their sense of feeling really understood, cared about, heard, warmth, and respected by us. So yeah, thank you for emphasizing that, Amy.
Absolutely.
And feel free to jump in at any time, both you and Uni. Okay, I do see a lot of comments in the chat. I'm not able to look through them, but please let me know, Uni or Amy, if there's anything for me to address. And then if chat comments are distracting for anyone, I know some people had expressed that in the past. If you just go to the bottom and you click that caret, that arrow up, you can uncheck the box that says show chat previews. Then it may help with some with ADHD or attention or a likelihood of distraction there. Okay. So now we're going into addressing resistance. And then after this slide, I'm going to do a demo and then make some space for questions before we share a little bit about the protocol and our cases. Okay. So addressing resistance, I think it's really helpful to set therapy up for success by addressing process resistance first. So anytime we're doing exposure therapy, we know the one piece of process resistance, which is what are they going to have to do that they won't want to do, includes just facing the trauma, facing the memories, the thoughts, and the feelings. So typically there's going to be a lot of avoidance. And we find that if we address this beforehand, it can be really helpful instead of just throwing the WET protocol at them. Let's first address all of the good reasons as to why they may not want to face this trauma and to continue to avoid it, right? Okay, but the first thing that we want to do is we want to just share with them that this is going to be a little bit different than traditional talk therapy and possibly even other trauma therapies that they're used to. So just setting up expectations at the beginning to let them know that the majority of this is going to be written. And instead of verbally processing your trauma, we see that doing it in writing is the pacing that's really helpful for the system to process the trauma. And it also seems to be less overwhelming for people. And so setting them up for their expectations is just letting them know, I'll do a brief check-in with you at the beginning of every session, but then I'll just give you the prompt for you to begin doing the writing, which will take 30 minutes. And then by the end of that, I'll do a brief check-in of how the experience was like for you, but we won't actually do any verbal processing of the content. And then I'll send you on your way with some instructions for you to continue to just allow the memories, thoughts, and feelings to come up. And in between the sessions before we meet again, I will read the trauma narrative that you wrote. And then that's what we'll be briefly going over, but I'll just give you feedback on it about like possibly it could be helpful to dive into more thoughts and feelings, but we won't actually do a lot of verbal processing of the trauma. So that's just setting up their expectations for it at the beginning. And then the rationale that we heard from Dr. Lack as we're going through this is why we're not processing the writing afterwards is we want to allow the clients a sense of self-efficacy. they can do this on their own without relying on something external to heal them, and that they can face it and sit with it in between sessions and see how just allowing it to process through their system can be really beneficial. Okay, I'm just realizing I still have Amy's in the spotlight. Can someone share with me how you're seeing it? Can you still see me, or do you see both me and Amy and the PowerPoint slides? I just
I
want to
can see
make sure
both
it
of you
shows
and
I
up
can see
well.
both of you, Tyann. Both of you.
Okay. Okay. Oh, thanks, Kaylee. It's so good to see you. Appreciate you. Okay. So just for the recording, I'm gonna unspotlight you, Amy, as I'm going through this. Thanks.
Thank you.
Okay. All right. And then this allows them to naturally have that internal processing and to sit with it and really see, I can do this hard thing. I can no longer avoid it. It wasn't the therapist's presence or processing it with me that allowed me to heal through. It's me facing this and doing this and moving forward that allows me to heal through the trauma. And then it gives them something more. Okay, hold on. Oh, Dr. Latgross is sharing that it didn't seem like giving them anything more or extra after the session seemed to benefit the process. So it just seemed like it was extra. So even if we were doing additional processing or gave them some additional tools to use in between the session, it actually wasn't too much different from just doing the WET protocol as is. So it was just something that didn't seem to be necessary as well. So we may feel the urge like we need to do something or give them something additional, but the protocol alone was sufficient in the healing process for people. Okay, and then we talked about a common symptom of PTSD is avoidance. That is the number one component of process resistance. What are they going to have to do that they don't want to do? And the WET protocol doesn't have homework. And so that's a nice piece of lack of process resistance that we don't have to address, but we do have to address the tendency or the desire to avoid. And it really makes sense to do that. And so I'll share with you, Uni and I will do a demonstration of how I address avoidance first before we even jump into the WET protocol. So an analogy that I've liked, I honestly wish I remembered where I had gotten it in order to give them credit. But I've really liked this analogy. I've learned it from somewhere else. I didn't come up with it myself, but I don't remember exactly where I learned it to give them credit. So if this is yours, or if you remember this and you know where it came from, please let me know so I can give credit to the person. But whenever I've done exposure work and trauma work, I share with them that it's gonna be like us walking through a sewage pipe together. And just imagine doing that. Like you're there, you're at the sewage pipe. Approaching trauma feels just like that. So I would even encourage you all to even imagine putting yourself there, like you're at a sewage pipe, you're about to walk through it. Can you actually begin to feel some of those physiological responses? Like it's going to feel disgusting. You can connect with the smell. You can feel it in your body, like it makes you sick, makes you kind of nauseous as you imagine walking through that, right? I can even smell it now and feel kind of grossed out and nauseous. And what we're going to do is continue to walk through it. And it makes complete sense that you're not going to want to go there, or a big part of you is not going to want to go there or to enter it. Because I can imagine like my whole system just wanting to run away when I'm there at the entrance of that pipe, right? But in order for us to heal through, we're going to keep going and we're going to keep walking through. And yes, there are times it's going to feel gross. It's going to feel disgusting. Your whole system is going to want to run back and stop and no longer do this. And my job is to continue to encourage you to keep going. And I'll be right here with you. And once you get to the other side, know that it's going to be different. How it's going to be different is going to vary from person to person. But for a lot of people on the other side, it feels better, it smells better. You no longer feel as stuck or trapped in that space that feels really dark and scary and disgusting. And on the other side, for some people, there's sunshine. There's a hot shower waiting for you. You feel like there's been a cleansing for a lot of people in that process, right? And if this makes sense for people and they have family, your family's also waiting for you on the other side. Because if I have clients who say, like, I'm not able to be as present with my family as I'd like to be, I've been so stuck in this, I've been avoiding even connecting with people, I'll share that piece. Like, your family's also going to be there on the other side, looking forward to meeting you again or to seeing you being at a better space again, right? And our hope is doing this hard work will help you be at a space where you feel more free from the impact of the trauma and being trapped by it. Okay. And so how we integrate addressing resistance from TEAM-CBT into the WET protocol is through positive reframing. How can avoidance actually benefit you? And what does it even show that you really value and care about? And then I'll do voicing the resistance. And then a motivation script. I'll just briefly go through that, but that's what I do and I use. And I use that a lot with my client because as she was going through this protocol, writing about losing her child a week after giving birth, she was very haunted by that whole experience, and especially the last visual of her child being there in the hospital, just looking very lifeless. It was very haunting for her. And so doing this was excruciating. It was painful. She wanted to stop at times. So I would rate motivation to continue. And there was a session where she said, I'm at 45% motivated to continue. This just feels very hard. Her system was very overwhelmed. And then we just looked at that motivation script again, and she's like, okay, I'm back at 80%. And so I'll share with you what's on that script and how I use that to continue to address motivation to keep going. Okay. All right, Uni, are you ready to be my client?
I am.
Okay, great. And just so you all know, we have disguised the identity of the clients of our cases just to protect their privacy and their confidentiality. And so Uni's going to play my client who has lost a child a week after birth. I'm changing some of the details in that process so none of them would know, even if they were to watch this training, that we're sharing about their case. But these are real cases that we have worked with that have been really helped with written exposure therapy. Okay, so so Uni, before we begin this process, as you know, we're going to approach this trauma. It's been very painful and a devastating event for you. I don't know if there are words that can describe what you've had to go through. It's probably one of the greatest pain, a human being has to endure is to lose their child. And you've shared with me, and I see on your PCL, your PTSD screening as well, that you've been extremely avoidant of the memories, of the thoughts and the feelings that comes with it. You've also been avoiding settings that reminds you of it. And in doing this work, we're actually going to move forward with having you face the memories, face the thoughts and the feelings. And I could imagine there may be a part of you that may not want to do that. I'm just curious, just even right now, where would you rate your motivation to even move forward with this? We've already talked about it's going to be like walking through that sewage pipe. Where are you 0 to 100 in terms of feeling motivated to do this?
Not very motivated at all. It seems just impossible to even think about right now. I would say it's closer to 0, not 0.
Mm. At a 0 to move forward with this. Yeah. And while I think this process can be really healing for you and help you meet some of those goals of being more present and not being so activated in your body around the trauma. It sounds like you're not feeling motivated at all to move forward. And that makes a lot of sense to me. And what can be helpful is for us to first look at this part of us that wants to avoid. What are all of those good reasons to not move forward with this? I wonder if there's even some real benefits, like protecting you, and it may be even tied to some of your deeper values, like some self-care or wanting to function better for your current child.
Yeah, I think just not talking about it or wanting to look at it, it's able to just keep going with what I need to do, the basic needs that I need to meet. Um,
Mm-hmm.
it's very overwhelming, and
Mm-hmm.
I just don't have the capacity or the time and the mental capacity to look into that. I,
Mm-hmm.
that was way too painful, and it's a pain that I haven't ever felt before, and it's
Mm-hmm.
scary.
Right, exactly. So I'm hearing some of the real reasons to continue to avoid and not move forward. As you said, I can't just keep going with basic functioning and just do what I need to do, because moving forward towards this will be overwhelming. And I'm hearing then a benefit is the avoidance is trying to protect you from overwhelm.
Hmm.
And it also protects you from feeling too scared because you said it's going to feel really scary.
Hmm. Right.
Protects me from how scary it was and it is. Right. Yeah.
Right.
Um, yeah, because it's only been 6 months, right,
Hmm.
since this has happened, and you had shared with me it still feels so fresh,
Right.
and and that it's gonna feel really scary to move forward towards that.
Right.
And I could imagine your system's trying to protect you from overwhelm by avoiding. And I wonder if there's also a value in there with being there for your oldest child.
Hmm.
Like, I wonder if you then approach this and you feel overwhelmed, if there's something in there that you value not going into that space so you can be there for your oldest child as well.
Right. There's that fear of, like, if I did talk about that, I might get stuck in that pain, and that I won't be able to get out and be there for my child. That
Mhm.
I won't be able to function the way I am right now.
Mhm. Yeah. Right. And even though you said your functioning has really decreased from when before the trauma, you're saying at least right now I'm still functional and able to care for my oldest. But gosh, what if I go there and I get stuck in the pain? How scary would that be? And then to no longer be able to be there for my
Very,
old, that feels really terrifying, right? What's coming up for you as you connect with that possibility?
and I might go through that loop again and not be able to come out. It took a lot to come to therapy, to
Mm-hmm.
even talk about it, and that fear that I might not, this might not work, and
Mm-hmm.
I'm reliving those pains again, and useless to my family. There's
Right.
a lot of fear.
Yeah. What if it doesn't work? What if I'm just reliving this pain needlessly and then I just feel worse, right? That's
Right.
usually a really common fear for people. And while I see that people going through this treatment, that's a really common fear for them. We also see it's very much like, that sewage pipe that I shared with you. Often there's a lot of fear of being stuck there, and who would want to stay stuck there? In that worst functioning, and it feels disgusting. It's nauseating. You feel it throughout your whole system. Um, but I also have seen for many people as we walk through this and this journey together, people do get to the other side. And at the same time, I totally understand that fear. And I'd like for you to really think of all of these good reasons why you've been avoiding and really connect with why should we actually move forward with doing this work if it's going to be overwhelming and scary. There are moments that you can really feel that emotionally, physiologically, that you're going to face some really hard memories, emotions. Even you sharing with me during the intake, you said it was really hard to even briefly share about it. And we're going to have you write about it in detail. Why should we actually move forward with this work, considering that possibility?
I gotta give myself a chance to heal, to work through this, um, to see if it's, it can work out better for me in my life. I know that's not going to be easy going through that pipe, but I know that I have to at least try.
What drives you to try?
My family, it'll work out better for my family. I know they need me. Um, I I I know what I'm doing is just the bare minimum, and that's just I don't know if I can live like for the rest of my life.
Mhm.
I don't know what that will do either.
Yeah, and at the same time, you made a really good point that you're saying going through this is going to be so painful, that you're afraid that not only will it overwhelm you, there may be a stuckness in that pain, and then you won't be able to care for your oldest, even at the bare minimum.
Right?
Why should we even risk that or going there?
I I feel like I'm actually stuck right now. And s- so if I don't do something, I'm scared that I'll just be locked in here um and I have to do this for my oldest child, but also for the baby that I lost.
Mm.
I feel like my baby wouldn't want me to just stay here, wants to keep going and live my life.
Oh, I know this is just a role play, but gosh, I'm feeling
Oh, me too.
some
I'm
of the
not about to cry.
emotions, and I'm seeing that in you as well, Uni. Gosh, life can be so painful, right? Yeah. Mm. Yeah, I'm just connecting with the hardships and the suffering that our clients go through. And it's so incredibly painful and devastating, some of these hardships. And at the
Yeah.
same time, that's where it feels so meaningful
Mhm.
to really do this work, right? And to really see people get on the other side despite fears of stuckness, fears of, I'll never get out of this because it's so devastating. I mean, my client actually literally said those words.
Right.
I'm just afraid I'm going to be stuck in this abyss and never come out of it. And then it was just so moving to hear you, Uni. I'm hearing you're saying that, but a reason to move forward, you're afraid that doing this work will keep you stuck, but you're saying I'm actually stuck now. And I'm afraid if I don't do something, I'm just going to be locked here if I don't do something. And you said, even this is not just for my living child, but it's for my baby. Like, my baby wouldn't want me to be stuck here. My baby would actually want me to live my life and to move forward. Um, what drives you to get out of the stuckness right now? Why is that important to you?
Yeah. Sorry. I'm very emotional to think about our clients going through this.
Mhm.
Um, I know that um, my family wants also a present parent and spouse and child, and I feel like I'm not able to give that to my family if I don't do this for myself. Uh,
Mhm.
to be to give my daughter who's here with me um, that love that I have to give fully, as I would do to the baby that I lost too.
Mhm. Yeah. Wondering what it's like for you right now to connect with these reasons to move forward instead of avoid what's coming up for you.
I feel like there's a little hope, and that there is a desire to want the uh the end of the tunnel to get out of the sewage. You know,
Yeah.
I do want that. I'm just scared how it would be to get there.
Mhm. Right. It's a desire to get out of the sewage. It's scary.
Mm.
But yeah, I'll be right there with you to show you some of these steps to help you through it. Where would you say your motivation is at this point as you connect with these reasons to move forward? Where you said, I have to give myself a chance to heal, to work through this. It's for my family. I know they need me, and right now I'm just doing the bare minimum, and I'm actually stuck right now. And I'll be locked in here if I don't do something. And you said it's not just for my child who's here and alive, it's for my baby as well. I just know my baby wouldn't want this for me. My client had also shared that it feels more honoring of my baby who passed, my child who passed, by um, actually facing it and going towards it
Mm.
instead of acting like it didn't happen. That was a big reason for her as well to move forward. And then you also said, my family wants a present parent and spouse. And if I do this, I can give my daughter that love that I have to give more fully for her, which has been a little bit more challenging as you've been feeling kind of numbed out or distant, right?
Mhm.
Where would you say your motivation is at now to move forward with this work from that zero?
Mm. About 40.
Yeah. Yeah. So you're at zero and you're just at about 40% ready to move forward. Um, in this situation, if a client was at 40, I would look at while there's improvement in motivation to move forward, I wonder if this may actually not be the best time to do that because you're a bigger part of you, 60% of you actually doesn't want to move forward. And me throwing this protocol at you or using an exposure tool to have you move forward when you're only at a 40% motivation, it sounds like it may not be respecting your system and maybe even your needs right now to actually not go there. Do I hear that right? That you're not quite at the space where it feels like the best idea to move forward when you're at 40%?
I know I do want to move forward, but then I think just writing, I'm a little nervous about that. And but I am wanting to do this work. I know that if I don't start today, I might not find motivation all the tomorrows. Like I just don't want to be stuck anymore.
Mhm. Yeah. What do you want instead of stuckness?
To be more free, and and I'm feeling the weight, so to be more present. And so I know that this is going to be hard, but it's a hard that I'm wanting to do.
Mhm.
I guess my motivation is actually more than 40.
Yeah, where would you say it's at when you connect with wanting to be more free and present? And even though you're nervous and you know it'll be hard, you want to get to that other side.
Maybe like a 70, 75.
Mhm. Yeah. Okay, great. Anything specifically in what you shared here from giving yourself a chance down to some of the additional things that you said that really increased your motivation there? And it may be the
Yeah,
combination of all of it, but I'm wondering if anything stands out.
I had a little fear that if I don't start, that I'll just stay stuck and that it'll just take away everything that I do want for
Yeah.
from out of this work and my family.
Mhm. Right, because you felt that stuckness in the past 6 months, right?
Mhm.
Yeah. So if I don't start, I'll just stay stuck. And then anything else stood out to you on what you wanted that drives your motivation?
I do want to honor my baby.
Mm,
I do want to not pretend like it didn't happen, like that she didn't exist. I want to honor her and her life, that the moments that we had with her, whether
mhm.
she was
Yeah.
in the tummy or not. It's just I want to honor her.
Yeah. You want to honor your baby, you said, instead of avoiding it or acting like it didn't exist.
Mhm.
Yeah. And even though it was just a week outside of the tummy, there's 9 months in the tummy to honor as well.
Mhm.
That makes a lot of sense. Yeah. And I'm highlighting these to really emphasize that motivation script. And usually I'll add in some of the other components as well as they emphasize, like, I do want to be more present. I want to be there for my child who's here. I want to give her all that love. Those are the pieces I put in a motivation script. And then when they're in a space where they're like, oh, this is so hard. I want to run away again. I want to get out of this sewage pipe. I would just actually look at that motivation script with them again. I may read it again with them. And for my client, after that really hard session, and she was at a 45, we just looked through the motivation script again. And she connected with, this is honoring for my baby. Um, I uh, I can do hard things. My family deserves for me to heal instead of being stuck. I can work towards being more present instead of numbed out. I've been numbed out to escape, and I value presence and connection. And so we just reviewed that. And she said, I'm back at 80. I can do this and I'll be back next week. But she was really thinking of dropping out after that really hard session. So that's how we used voicing the resistance and the motivation script to help people continue to move forward in their own wording, in their own voice. And as you see, it's not me telling Uni, like, yeah, you really need to move forward because your oldest child needs you. Imagine how that would feel versus Uni actually being able to verbalize, I need to do this. Um, I don't want to stay stuck. I'm stuck right now. I'm afraid of being stuck, but I'm actually stuck right now. And I want to be free. I want to be present. I want to honor my child instead of acting like she didn't exist. Right. Any thoughts from you, Uni, on what that was like going through as the client, other than it's it's emotional work, it's hard work, and we can empathize with the client as well, right, on how excruciating some of this is.
This is hard, but I can see how doing this work before jumping into the protocol can start that fire, that reason, and having that script ready, you know, instead of just throwing it out there. I think you can lose that desire and why when you're talking about the pain. But having this by you, having done this, there's surely a benefit
Mhm.
that's seen, and I see it in my clients, and I just got so heavy there. Just that this is very hard work. Like they come
Mhm.
to us because it's hard and they need that guidance. And if we're pushing an agenda when they're not ready, that's again them forcing self to feel something
Mhm.
or avoid something that they're
Right.
not ready for.
And if my client stays at that 40%, because usually they'll start out at like midway, like I'm about 45% ready. And after voicing the resistance, they may go to 70 or 80. But if my client stayed at 40 and I didn't assess for that, and then I threw them the protocol, I think that that's probably some of the reasons why, like 68% of people no longer meet PTSD after the WET protocol, but that's 32% that
Right.
still didn't get helped. And I wonder if we address resistance for them, how that could be helpful. And if it's at the 40% and it stays there, sitting with open hands means I'm not going to force you through this. If your system is saying right now I'm at 40% readiness, even after going through these resistance tools, we need to respect the system because it's saying this is more functional right now. This may be too much at this time. And if you force me to go there, I make it to a breaking point that I can't be there for my child. That's not an exaggeration or a delusion. We really need to respect that they know their lives, they know their system right now, and right now they're not at a space where they want to move forward with this. Even if right now I'm barely going by and it's bare minimum, maybe it's better than if they were to face the trauma at this time. And sitting with open hands would mean I really respect that. I'm not going to force this protocol onto you. And we may do work to address other things. And we may give it time where they say, I think right now I'm more ready, right? Or just allow them to sit with those good reasons to not move forward. And if it changes, then to let us know.
Right. I'm glad that you addressed that. Because after you addressed it, there was this fear that playing the role, but I felt that empathy that, oh my gosh, I'm going to be stuck. And if I don't do something, there's an actual more motivation than I thought when that changed, that it was like a spark that just happened at that moment.
Mm-hmm. Yeah, so true. Like, even though you're just in the role play, I see that with people when we do the motivation work, they tap into their own spark of motivation and what drives them to move forward too.
Right.
Okay, thank you so much, Uni, for helping with that demo. Before I move on to the rest of the content, were there any questions or clarification points that needed to be made before we move forward? There's 23 comments. I'm not able to go through them if you did have questions. If you had something, if you could open your mic or if you could type it in again now, that will be easier for me than sifting through.
I had a quick question, Cyan.
Yeah.
This is more about just process. That was a beautiful role play, by the way. Both of you are amazing. But my question was more just on a functional process piece. I see all of my clients virtually. And so how are you getting what they write? Are they emailing it to you, or what are you doing to make sure that that's safe and that you can get the narrative in a way that feels okay to everyone?
Yeah, really good question. I'm all telehealth as well. And so I have Google Voice the paid plan, and it's HIPAA compliant for texting. And so what my client did was just, so in the camera, I can see that she was writing, and, it's at an angle where we see they're doing the work. And why that's helpful is that, like, if they're dissociating or if they stop, we can do some prompts to have them continue. But then afterwards, she just took a picture of the narrative and then she texted it to me, and felt good about that process. I wonder if you have concerns about that as well, though, and maybe there's other thoughts. I know, like, some of our EMRs are HIPAA compliant, and I'm thinking some clients would be comfortable with emailing it to you as well if, we just ended up deleting it. What are y'all's thoughts on that? Any thoughts from you, Kaylee, with texting or emailing or using the EMR, or from Amy and Uni to answer that?
I'd love to hear anyone else's thoughts on this too. I just know I'm with a big agency. And so to get something approved for for emailing. I know with our emails, we put PHI in the subject line so that it's encrypted, but then some clients, if they don't have computers, struggle to do that. So it's just, virtual has always been a thing we're trying to troubleshoot, but I really want to try to incorporate this model. So I want to find a way to make it work.
I also use the EMR or the Google Text.
Okay.
My clients feel secure knowing that it's HIPAA protected. Even on the Zoom, sometimes they'll write some notes on there and they'll handwrite it and take a picture and send it either through the email or through the Google Text. And I haven't heard anything else other than that.
Yeah, I know there's definitely a way. It's just like a holy grail way for an agency to figure out what we could do. It looks like some people are putting some good ideas in the chat too.
Yeah, it looks like there's a
Thank you,
resource here. OMD is HIPAA compliant where you can upload documents and it's free. That's really nice. Thank you for that resource, Lynn. Oh, that's good to know.
Simple practice.
Yeah, simple practice or EMRs are usually HIPAA compliant.
Mhm.
Okay, the question, what is a minimum percentage of resistance change before we can safely proceed? Anything that's 50 or lower, I don't proceed for sure. Even 55, I'm hesitant because a much bigger part of their system is, still like not really wanting to move forward. And so I just want to make sure that they can sit with that. So even if they're at a 55, I may say like, it sounds like a bigger part of you wants to move forward, but like there's still 45% of your system that doesn't want to move forward. And I feel a bit hesitant in doing that. And I'm wondering what your thoughts are as you're feeling, I wonder if you're feeling a bit torn as well when you're at a 55 and see if it can bump up anymore. I usually like at least 60. I feel safer when it's even 70 or higher for people, but at least 60, then I feel pretty good about moving forward with people. And sometimes too, they just need to dive into it and then motivation improves even more beyond the 60% as they see like, okay, it wasn't as bad and I can face this and I'm actually not getting stuck as I was afraid of. Yep, great question. Okay. Yeah, Amy says she has G Suite. The patient emails it to you. That's right. We can do an email in G Suite where we sign some form. I forgot. I'm thinking of a cow. It's like an MOO form or something. Do you know what I'm talking about?
There is
No, it's a sheep.
a
The
business
BAA.
associates agreement. Yeah, BAA. So that it's HIPAA compliant. Yeah.
That's right.
Moo.
Bah.
That's so funny. I'm having like a farm animal association. So I was like, was it moo? Was it MOO? No, it was a sheep. It was BAA. And if you sign that, then it does become HIPAA compliant through the email as well. Yes, that's true. Yeah, loving the sheep emoji. Thank you for that. Okay, so let's take some time to go through some of our cases here, and then we'll wrap up with some time for questions as well. Okay, I want to give Amy all the credit for this. Hold on, I think I forgot to unspotlight Uni. Okay. Because I mainly have addressed avoidance, but Amy had thought it was also a good idea to look at what if other PTSD symptoms come up? Maybe we could address some of those as well. So this is more of that outcome resistance. Maybe some of their symptoms are benefiting them in some way that we need to honor first. I'm sorry, I think this was, okay, this is just something you can read through for some sample wording in what Uni and I had just done. And then we're also looking at addressing outcome resistance. So if you could get rid of all of these symptoms, because they say I'm so activated, I feel, overly alert, I'm on guard, I'm just like on adrenaline all day long and I want to calm down. That's the part of them that wants to change that symptom. But there's another part that has these symptoms, and we want to honor the part that has these symptoms as to why is this here? And maybe it's doing something for you. And so we can first address hyperarousal if they want to get rid of it. If you could push a button to get rid of that symptom, would you? And most people would say yes. And it can be helpful to first look at, but a lot of times these symptoms develop for a reason. And it can be helpful for us to see why may you have these hyperarousal, hypervigilant symptoms. I'm hearing some background noise, so if you all could be sure to mute yourselves, that would be helpful. Thank you. So some people with hyperarousal symptoms may say it keeps me alert. It protects me from danger, protects my loved ones from something bad happening again. And so my client had gotten much better, but then became pregnant again. And then we saw that hyperarousal symptoms came back. And so we could really honor why that's there. Shows I value safety, and you could probably think of a lot more reasons as to why those symptoms are there. And a lot of times it's for safety and protection. Also, positive reframing of numbing out. So if they have this symptom, so we know hyperarousal is one PTSD response, but another PTSD response is numbing out or dissociating. And so we could look at what are the benefits of that, because I'm going to have you move forward with no longer numbing out and facing your feelings. Your dissociating part has been really helping you. What has it done for you? It's protecting me from feeling too overwhelmed. I want to stay functional. It's keeping me internally safe, right? So why would you want to move forward with no longer numbing out and facing this hardship? And if they're having reliving or flashback symptoms, we can also look at those. And this really reminded me of a veteran that I worked with. And he had some really awful flashbacks, even 6 hours of just forgetting time, replaying some of these horrendous scenes that he went through in war. And at that time, I was only trained in EMDR, but we were just getting so stuck. And then once we looked at maybe there's some benefits of the flashbacks that I need to honor. And what helped us to get unstuck was, he said, I don't know if I want to get rid of the flashbacks, because what if I forget them? What if I forget my buddies who died, and we've bonded? We've gone through literally life and death together over and over again. And this is my only way of feeling connected, because I'm afraid I'm going to forget them. And then once I addressed that, where I said, wow, your flashbacks has been your only way of staying connected to your buddies that you've lost, over 5 years now. So if you no longer have your flashbacks, you're afraid that you may lose them. Why should we move forward with healing through these moments of reliving and flashbacks? And he said, well, my buddies are gone, but my kids are still here, and they need their dad. And I don't want to be gone for 6 hours, half a day, and not be there for them anymore. I've been gone long enough, right? And so in addressing that was a piece of stuckness that I didn't even realize that we needed to honor and to really talk to before we could actually move forward more in the work together. So yeah, that's my only way of feeling closer to them. And if I no longer have flashbacks, what will happen? And then he also talked about, I'm not ever gonna forget them, but I don't need to relive the horrors that we've been through either, right? And then what we see when we address resistance in this way and honoring these symptoms, it really helps to decrease shame about the symptoms. And when we befriend our symptoms instead of villainizing them, it just allows them to see the symptoms in a different light. Like, my anxiety's here for a reason. Even flashbacks have been there to help me work through it, or to process it, or maybe even keep me closer to the people that I loved. And even for my client, while we didn't address it with the grief of losing her child, it did come up at a point where she talked about, like, I'm afraid that as time goes on and I do this work and I heal and I no longer feel this intensity, does that mean then that I don't remember my child anymore, or it no longer impacts me? And so there was something about her high symptoms that then was linked to her love for her child and remembering the child that she lost. And so we also then looked at, for her, like, while my symptoms decrease, my child will always matter to me. And I'm just no longer stuck in the trauma. I'm able to still honor my child and be present for the living child as well. Right? And then for some, it can be helpful. Like, so you have all of these hyperarousal, numbing out, reliving, and flashbacks. So you're right now at 90% on hyperarousal. Is there a level? How much of it should we keep of the hyperarousal in order to then allow you to stay safe and be alert, but not be stuck in constant exhaustion, right? So we could do that with the magic dial. Moments of reliving our flashbacks. And it's not like we can control that. But for my client, it was like, there are moments where I may just want to be there and go there back into the memory. But I don't need to do that all the time. So I can choose to go back there, and that's how I can connect and remember those last moments with my child. And so I can do that maybe on occasion, maybe on the anniversary, but I no longer need to be pulled back into that constantly either, right? So that could be the dial. Okay, let me review the protocol just briefly. It's a pretty simple process, actually. It's 5 sessions in what it was studied. That was all that was needed for people to no longer meet criteria for PTSD. We measure SUDS, subjective units of distress, before and after each session. The first 2 sessions is writing about the trauma in detail, diving into the thoughts, emotions as they remember it today. So it's not in the present tense. This is what happened in the past. So that's a little bit different than prolonged exposure. And 3 to 5 then adds in a processing component of how has this trauma impacted them or changed their lives. And they write for 30 minutes. How we choose a memory is just, first let me go through, so just choosing when to start and when to end is just, when do you feel like the trauma began? When did you realize that, oh, this traumatic experience is beginning in this moment? And so for mine, it was, when I had my child and she wasn't breathing. And then the end of the trauma is after we found out our child has passed. And then in choosing a memory, we sit with open hands. We allow them to choose whatever trauma they want to work through. So even if they had a 20-year history of childhood trauma, they can choose just one trauma memory. And it can be helpful that they remember it more vividly. We're not trying to uncover memories that have been suppressed. It's a memory that they can remember from beginning to end. A good guideline through EMDR is they can choose the worst or the first. This usually has the most impact in healing for people. But if they're not ready to go through the first trauma memory or the worst one that they've had, we can just start with one that's less distressing and then work up to the worst memory. Okay, and then this gives us 5 minutes each to go over our cases. Oh, I'm sorry, I forgot to share with you all the WET protocol real quick. So I had put this together, but it is their content from the manual. And so if you want my copy of it, I ask that you buy the manual. And then I can send this to you. I just found this to be easier to have it all in one sheet that I can look at because we're reading some of the protocol verbatim. And then in the bullet points, I just typed out some of the step-by-step things for us to do. Ask if the instructions are clear. Ask for their SUD ratings again. These are just some of the to-dos, and this is just what I follow. So I just wanted to share with you a sample prompt. I read this verbatim to the client. So this is session 2. Today, I want you to continue to write about the trauma as you look back upon it now. If you feel that you didn't get the chance to completely describe the trauma in the last writing session, then you can pick up where you left off. If you've completed writing about the trauma event, and in the protocol, they say you can replace trauma event with the event of losing your child or the sexual assault. But that's the only thing to change. Instead of the trauma event, you can specify what they went through, but everything else you want to read off verbatim. So if you've completed writing about the event of losing your child in the last session, please write about the entire trauma again. While you are describing the trauma, I really want you to delve into your very deepest feelings, the fear, shock, sadness, anger, for example, and thoughts. Any thoughts like, is this really happening? I'm going to die. Also remember to write about the details of the trauma. That is, describe the setting, the people involved, what you saw, heard, and felt. And remember that you are writing about the trauma as you look back upon it now. Okay, and then I asked, do you have any questions about the instructions? I asked for their SUDs. I remind them I'm just keeping track of the time. They have 30 minutes to write. And then if there's no questions, I just prompt them. And then I always send this prompt to them as well, an email, so they can look at it in case they forget anything in that process. But that's pretty much it. And then we go through that 5 times. I actually went through it with mine 8 times, and I'll share with you why. But that's pretty much it for the protocol. It's very straightforward, very easy to implement. Not a lot of intensive training is needed. Okay, and then I'm gonna go ahead and pull in Amy to share about her case.
Okay.
Okay, you ready, Amy?
Am I unmuted?
Yeah.
Give me a funny message. Okay. Yeah, so yeah, the patient that I have worked with WET is a patient that I'd actually been working with for some time previously, a 65-year-old man with really prolonged and extensive trauma from early childhood until he left his family as a teenager, including just real total neglect by his mother, no warmth at all, and sexual abuse from age 3 onwards by his father. And we had tried a number of things before trying WET. So we'd done cognitive work in the TEAM framework. We had tried the most helpful thing thus far had been IFS, internal family systems, but we got to a place where we were really stuck there, where the parts of him that were protecting him from going there to that, especially the trauma related to the sexual abuse, they just were not ready to go there. And so when we all learned about WET together, I was suspecting that my patient would actually say no to this. I'm not willing to go there. But he was actually quite open to it when it came to facing the trauma related to the neglect by his mother. Still not willing to go to the abuse by his father, but willing to go to that memory of neglect by his mother, and was able to pick out a particular memory that was very vivid from that. So we worked through, in this case, 5 sessions. The initial SUDS, the initial distress, was a 75, and peaked at a 95. That was after the second writing session. And then by the 5th session, came down at the start of the writing. It was a 20, was a 50 at the end of the session. But we saw a big drop in the PCL from 31, I think it's on the next slide, Tyann, from 31 to 16. Yeah, there it is. And we also saw some big behavioral changes. So this was someone who was avoiding interactions with some of his family members entirely because of feelings related to the trauma. And he started connecting with these family members again, really after session 2. I'd been seeing him for years, and only then, after a couple sessions of WET, did we see some of these changes. After that, after he saw the change that came about from facing the memory with the neglect by his mother, he was really finally actually ready to face the memories of the sexual abuse by his father. He volunteered himself that he really wanted to do this, even though he was terrified. And so we're actually still in the middle of that work, near the end of it, though. When we started, he rated the PCL separately, sort of with a focus on how the sexual abuse was affecting him, and the score there was a 51. His starting SUDS was a 200, and in that first session, it dropped from 200 to 75. We then encountered some difficulties where he thought he was really sort of still avoiding a lot of feelings. And so we did some more positive reframing of the avoidance, and the voicing the resistance, the motivation script, and he was able to continue going, and really actually his SUDS went back up.
So I just need to know, yeah.
Oh, I think
Just for
somebody
an hour.
not muted. So
Amy, if you can unmute, I'm sorry, I muted all to mute the background noise, and it also muted you, unfortunately.
No
Sorry
worries.
about that.
No worries. So his SUDS went back up to 150 after that for a few sessions. We actually decided to add an additional session with the instructions from the first and second sessions of just focusing on delving into thoughts, feelings, the details of the trauma, without going to how did it affect his life. Because one of the ways he avoids is through analyzing. And we felt that those instructions really sort of brought out that analyzing that made it harder to access the feelings. So we added one more session with those instructions for the first two, and have now done two more. After the fourth session, the SUDS was still at 150, but the PCL was down to 21. And after our last session, we haven't rechecked the PCL, but the SUDS went down to 50 at the start of the session and 25 at the end. So we're seeing a real shift. We plan to do one more session because he feels that there's still some stuff he hasn't quite faced. But he's really motivated, and we're seeing some real shifts in behavior too. And yeah, and maybe I'll end there because I want Tyann and Uni to have time to share their
Thank you
case.
so much, Amy. I just feel very moved by your client's case and the courage that it took to, like, you sat with open hands and allowed him to first choose a less severe trauma to work through, which felt really important for him then to be able to choose the more severe trauma of sexual abuse by his father. And how incredible to go from 200 SUDS, like way above, the 100 is the cap. And he's like, I'm at 200, to then come down to 25 by your latest session. I'm just in awe, by the courage that your client had to have to muster to face this, and then to keep going through the stuckness of the 150s to actually getting at the space of 25, and then no longer meets criteria for PTSD for both. Because as we shared, 31 to 33 is the cutoff point, and he's doing incredible. So thank you so much for sharing that. I wonder if you also feel in awe by your client after you've tried so many things and going through this.
I really do.
Mm-hmm.
Seeing such shifts in such a short period of time after we had tried so many other things.
Yeah.
Yeah, and just seeing his real determination to actually now face what he had been avoiding. Yeah.
It was like complete avoidance, like, heck no, I'm not going there, to like being self-driven to do this work is pretty incredible. And it sounds like you did some motivational work with scripts as well. So awesome case. Thank you so much again.
And I did just want to say, in response to Jill's question, I was using the scale of SUDS 0 to 100. And he said 100, but really I would have to say 200. So it was on that 0 to 100 scale.
That's just how severe it was, how severe it felt for him. Yeah,
exactly.
Great. Thank you so much. Okay, Uni, want to make sure we have time for your case. I've already shared most of mine, so it's going to be really short for mine.
Right. So in my case, I have a 27-year-old female that I've been working with for, I think, about 2 years on various topics and situations. And I think it was more about a year in that she told me about some of her traumas. And one that we used, the WET therapy, was on this trauma that she works with minors. And soon after she graduated, she started working for this company. And and she was one of her duties was to spend time with these students in storytelling or if they or playtime. And during one of these times, she noticed one of her students wasn't really engaging, and so she took it upon her to just check bases with her, spend more time with her, and they built a friendship. And during one of the times that she was spending extra time with her, the student had started disclosing some unusual behavior that she and was the student was scared to tell my client. And then I think it was maybe another 2 weeks later when the client, when the student told my client about another worker sexually abusing her. And so my client immediately did what she was trained to do, which was the mandatory reporting, and got the police involved. It got the child welfare involved, the parents involved. And shortly after that, her colleagues, her direct bosses, they all started accusing her for wrongfully reporting, and started ridiculing her, questioning her abilities, questioning her degree, and just she was very scared to talk to her bosses. She felt like she did the wrong thing in one way, but also she knew that what she did was her training, what she was told to do, and wanted to make sure that her student was safe. But she told me that the mandatory reporting itself was stressful, but what really set her anxiety up was when she was questioned by her bosses. And she since then has had this fear of being around minors alone. She's scared that other people might accuse her of being a predator. She makes all kinds of efforts to not be alone with any minors, always falling to the T, but to the point that she's always so stressful about when a minor talks to her, what other people think. And we did all kinds of work on this, and just to get her to do some things that require her job required of her to be engaged with students, to what we even did positive reframing, which she really liked. She loves and she values working with students and with young adults as well. And but that's something she feels like she's very passionate about, but scared that because of this trauma that she experienced, that she won't be able to work in this field again. And when I introduced a wet therapy, she was very excited to try this out. She was a little nervous because she doesn't really like writing, and she's scared that if she wrote things that people might find out, but she was still willing to give a chance. That's where we did all the motivation script, and she said that she's really wanting to follow her passion and working with young adults, and this is something that she would want to do for herself so she can get to that. So her motivation to do this work was about 85 initially, and then as we started working, she said her motivation kept increasing, which was really cool to see. When we started the wet therapy, her SUDS were at an 80, and we had to have 7 sessions total, because initially her first 2 sessions, she was just writing all the details that led up to the trauma. And I was new to wet therapy too, so I was not sure how long I can, if we can extend another session, until I did a consult with Dr. Lack, and he was like, of course we can, to get her to pull in more of the emotions, more of the thoughts that were that was going on during that traumatic event for her. And so that's why session 2 was 2 sessions for her. And then when she was doing session 2 the second time, she actually wrote more of her feelings, more of that fear and the questions she had, of whether she did the right thing, and whether she's okay to question this authority figure who's telling her she did something wrong. And in that moment, her SUDS that day, which is the 3rd session, her SUDS was actually like 80. But after we did that, her SUDS went out to 15. And that's the first time she's in those 3 sessions that she actually got to a 15. Before it would come down from 80 to a 40 or a 50. And then we did a session 3, which in session 3, you'll see in the protocol that if they haven't finished their story, or if they haven't finished that you want to continue doing that, or jump into how has this trauma affected you? And that would be the second part of session 3. So she spent another extra week writing in more of her feelings, which she said really helped her to pull that instead of jumping it ahead. And I guess that's that, sitting with open hands. And afterwards, she said if we finished the protocol in 7 sessions, and her SET scores were a 10, and she said it's a good 10. It's a 10 that keeps her vigilant. It keeps her to help her to stay engaged with her students, but she's not as stressed as anymore when she's alone with the student. She's not worried, because she knows that her morals. She said, my values is to protect her students, and that the 10 is a reminder for her how to give a good balance of being vigilant and protective, but not be overwhelmed. And she really liked this method, this WET therapy, that she's wanting to do this for her own sexual abuse that she went through. But we haven't started that yet. We're going to start that after the holidays, and I'm really eager to see how that works out for her. That's it, Tyann.
Okay, thank you so much, Uni, for sharing about your case. I know it is noon, and those of you who are asking about CEUs, you can complete this feedback form that I just sent into the chat. Once you complete that, it'll send you your certificate of attendance with your CEUs on there. And it is noon, so those of you who need to head out, please feel free to do that. I will probably just have like 5 more minutes. I do have to run at 12:15 to get to training, but I'd like to also make some time for questions for people as well, because people ask some really good questions. So thank you for sharing about your case, Uni. It's pretty awesome to see the drop from 80 down to 10 to 15 while you honor. Like, it makes sense to keep some of your symptoms, but such healing and relief when you could see them go through that, right? Yeah, I've already shared all of this with my client. The unique thing about her is SUD scores fluctuated. The lowest it got to was about 40, but by the end of our 8th session, I think she just dug up more and more memories. It was still at 80%, but the PCL by the end of it was at 24. So she went from 45 to 24. So she no longer met criteria for PTSD. And so I think this is unique in that internally, we talked to Dr. Lack about this, and he said that internally, that prolonged grief can actually continue to feel quite disturbing into the first year. But what's valuable is if we're seeing they're still making those behavioral changes, it makes sense that, okay, she's seeing her child's dead body. It's still quite disturbing. But she was no longer avoiding hospitals. She was no longer avoiding like the newborn clothes. She had put that away, and she actually, through some of our work, actually pulled out his little hat to like smell it and to hold it. And then was just able to talk about it more with family, like when her oldest child would bring it up, or discuss it more with her husband. So being able to go through the instructions of keep facing the memories, the images, the thoughts, allowed her to no longer avoid. And she did feel like it was incredibly helpful, even though towards the end, she was still feeling that 80 SUD score. And we did do some IFS at the end of that too, because the protocol does allow us to use additional treatments if needed, in case it feels like it could be beneficial. And so she just had an image through IFS. It's like a time projection. So going back into that space, she saw herself as like this dark, dead figure that just had no life, like was just crouched up. And through the healing process, she was able to take herself out of there, but also told herself, I can come back here whenever I need to reconnect with my child. It's not all or nothing, because before she thought like healing meant I could never actually come back to that space to connect with my child. But she's like, sometimes I want to. Sometimes I want to be there to connect, even though it was scary and hard. And at the same time, then she was able to take herself out of that space and just into the nature under the stars. And at the end of that, she's like, I'm no longer this black, deadened figure. I can stand upright now. But the color was back in her, and she looked more like the night sky with stars versus just like a black dead figure. It was really interesting through the time projection, through the healing steps, what came up. But she felt the whole process was really helpful and felt really proud of herself for doing the written exposure therapy as well, because I shared with you she wanted to drop out a couple of times, especially after one very hard session. So I think it's very empowering. These are just additional resources. We shared with you, we consulted with Dr. Lack, who is a trauma and OCD specialist here in Oklahoma. He has his own webinar. This goes through a little bit more of the basics of PTSD if you're interested in that. And it's more to fidelity of the WET protocol, not integrating the team components. And those of you who want my a Google document of the scripts and the instructions, you have to buy the treatment manual because it's theirs. It's their content. And then if you can complete this form by Sunday, I'll send my Google document out to everyone by Monday. Okay, this form just verifies that you've bought the manual. You've sent me just proof of purchase, like just a receipt or an email or something like that. And then I'll be able to send that out to you all if you're interested in that. So thank you so much again for attending and for your feedback. We really value any areas that you connected with or anything that could be improved to help us improve our trainings in the future. So thank you so much for your time. Sorry we went a little bit over time, and I'll be able to answer questions, but please feel free to head out if you need to do that. Okay. And I'm just going to send in the feedback form again for those of you who weren't able to access that earlier. One question that we have in the chat is what happens if while they're working through this one memory, another memory comes up? The encouragement is that they go ahead and still finish the protocol, because the question was like, do we start another protocol for the second memory? You can, but you want to move through the first one first, through the whole 5 sessions, maybe 6 if needed, or 8. And then you can do another protocol of the WET process for that second memory. Dr. Lack has found that even like 20 years of prolonged trauma, complex trauma, he hasn't needed to do more than about 2 a series of WET with a person before that specificity then really generalized to all of their PTSD symptoms. So I thought that was really cool to know as well. Can they do this as homework? They don't encourage it as homework, just because for us to be there in session with them, we can prompt them. We can also see if they're dissociating, like we may see they're writing and then suddenly they stopped. And then we can encourage them to like, okay, let's get back into your body. Can you keep writing? And then just having the prompts from us and the processing, and it's not technically processing, but the feedback at the beginning of what they're missing and what they need to do. And at the end of just giving them instructions to continue to face the hard memories seems to be important too. So instead of doing it as homework, it's helpful to do it in a therapeutic setting. Was there anything else that I missed? Those were the 2 questions. Oh, doing it in group therapy. You asked this question, Amy. Do you remember what Dr. Lack said about doing WET in groups?
So he said that there was a study that recently came out looking at how effective it was in I think it was like a intensive treatment program, like in a hospital setting. So doing it in groups with people in the program, and they found that it was just as effective that way as if it had been delivered individually. Although I realize a question I didn't ask Dr. Lack after that was, if that were the case, if you were doing it in a group, sort of how would you address it if one person in the group, for example, were dissociating or having trouble continuing? I feel
Question.
that that would be distracting to the other members. So yeah.
Yeah. And in between too, that's a lot of scripts to write. I mean, to read through if you were doing it 6. But yeah, it seems like it can be quite helpful for a lot of people in group as well. Okay, we are 10 minutes past, so apologize for running a little bit over time, but I did want to make some space for those questions. If you have any additional questions, please feel free to email me and we'll be happy to send out some responses about that. Or put it in the feedback form, like there's additional questions and comments that will allow us to consolidate all of the questions and send them out, send answers out as needed. Okay. Let me see if there's any. I have 5 more minutes. Do you all see any other questions that I had missed? I'm trying to scroll down here. I answered CEUs.
Yes.
I
Okay.
had a question, Diane. It's Jill.
Yes.
I put it in the
Hi.
chat box. Hi, you guys did a beautiful job. Thank you so much. I
Thank
think this is
you.
such a silly question, but maybe others think it too. But I'm wondering, as a therapist, what are you doing while they're writing?
No,
Both
that's a
in
good question. I just saw that.
actually like telehealth, you know, you're sitting here on your screen, they're there and they're writing. I do sort of have this fear that my patients will be like, and I'm paying you to watch me write. Like, so I'm just curious if that comes up for you guys.
I was already laughing as you were talking because I saw your question as you were sharing, and I had the same question. Like I had the same thought. I'm like, I feel a little bit guilty that I'm actually sitting here doing work, like emailing while this client writes, but I'll share that with them that while they're writing, I'll still be on screen. I'll be present. I'll also continue to monitor if there's any dissociation, to encourage them to keep moving forward. I had a moment when my client like just got so tearful she couldn't continue. And so then I would be there to like, let's pause it, let's slow down, let's get them back into their system. But I do share with them like I'm here and I'll observe, but I'll also leave them their space to write and may engage in some other things for the next 30 minutes. No one has had any issues, but I have also found myself feeling a little bit guilty, like, oh, they're paying me to sit here and write, uh, for the time. But when they felt really helped by it, and moments where I'm still connecting, no one has complained about like I'm paying you for 30 minutes while you're sitting there emailing. But yeah, I think that's a good question. Did y'all have any other thoughts on that, Uni or Amy?
I had the same thing, and once I think the first session I had closed my video, and she asked me, she even said, "Is it okay if you leave the video on?" And I'm like, "I apologize, I didn't mean to turn off that." So just sitting there with them really helped. And she said, "I really like it, even if you're muted, to just being there." And I'm like, "There's value in just sitting there with them." And it also has the one time she started feeling very anxious. And so I had to check in with her and we did some deep breathing and just getting back to that grounded, and she felt better and started to continue writing.
Interesting. My patient actually expressed a preference that I turn the video off so that he could just focus on the writing. But I did let him know I would be there and be watching and would sort of come back if I saw that he was struggling and needed some help sort of refocusing. And in fact, at one point in our work together, he did sort of stop, and we were just a minute away from the end, and I just came back and checked in, and he said, "You know what, I think I'm done." Yeah, but
Right.
he seemed to prefer that I just have the video shut off and he focus unless he needed me.
Right. And he even requested several more sessions. So sounds
Yeah.
like it still felt beneficial to pay you to be off the screen for 30 minutes.
Absolutely. Although I too have felt that sort of awkwardness and guilt about it.
Right. And two, I also thought like I'm also reading through the narrative afterwards. So that was my justification of like, you're paying me for that time too. And doing that work because I'm still there and I'm still with them. Yeah. Okay, thank you so much, everyone. I do have to wrap up here, but thank you for your time, for being present, all of your great questions, and I hope you all have a Merry Christmas with your family. And 2024 is around the corner. It's pretty crazy and incredible. So take care for now, and looking forward to next time. Thank you so much.
Thank you very much, everyone.
Bye.
Bye.